Hello, my name is Dr. Cheryl Burdette, and I am the director of the clinical curriculum for Origins Incubator. And this week, we talked about the 5R program, and we talked about, is this something that we want to do sequentially, or how do we approach this with our patient population? And in that discussion, we looked at how the various R's in terms of remove would also help with the repair, and the repair also helps with the reinoculate. And so really came to the conclusion that this is a framework to help our patients understand that there's a strategy and there's a next step. And it's not really something to lock the clinician into doing this thing first and this thing next, because we always want to be able to individualize. And so within the scope of that conversation was also the topic of PPIs and what do we do when we are faced with this. We will have these patients on PPIs. They're horribly nutritionally deficient because they've been on them way longer than they should. And now, as soon as we try to get them off, they have distress from that. And so one of the things about the discussion, it was just affirming every time we get to hang out with colleagues and have these conversations and understand that this is something that's not simple for any of us, and that we've all struggled with it. And sounds so simple, just transition somebody off their PPI and their nutrients will go up. Well, that's not really the way it plays out. So we got the affirmation of understanding that we all struggle in this area. And so there's a couple of reasons for this, at least. The first is that when we are on PPIs, of course, we make less hydrochloric acid. And that's the whole point of it. And the research is very clear that when that's the case, we leave larger proteins intact, and those things will atrophy the gut lining. So the longer you're on them, the more you wear down the gut lining. But it's not the only way they do that. And in fact, if we go to PubMed, there is a huge body of research that talks about PPIs and atrophying the gut lining, because the second way they do that is they inhibit the breakdown of asymmetric dimethylarginine, ADMA. And when there's higher levels of ADMA, it inhibits our production of nitric oxide. Well, we need nitric oxide in order to have good blood flow to the gut. In fact, if we look at the area of where there's a large study right now, a large focus in terms of Crohn's disease, one of the drugs that they're working on developing are things that increase nitric oxide to the gastric lining. So it's even got a focus in terms of a whole strategy for treatment of things like irritable bowel disease. So again, here we are, we're on these PPIs. The first thing that happens when we get on them is our cells in the stomach say, no, we need hydrochloric acid. So we upregulate the amount of cells. So now if somebody tries to just come off a PPI, immediately they have more cells making hydrochloric acid than before. So their initial response or feeling is, this hurts even more than it did before I got on these. I must really need them. And it's very difficult then to convince or help a patient to realize, no, they are inhibiting nutrients, and there are things that we need to work on in order to get you back in place. So that's first, that if you just tried to quit them all together, you're producing more hydrochloric acid than you were. So of course it hurts even more. The second thing is now you've actually atrophied your gut lining for a couple of reasons. Proteins have irritated it more, and you're getting less blood flow. So we went through a stepwise discussion of how we get people off PPIs. We talked about introducing demulcents first and how you want to go about that. We talked about deglycerized licorice and things like melatonin that increase tone of the lower esophageal sphincter, so people won't feel bad when they're doing it. And then we talked about introducing pancreatic enzymes and continuing to move somebody through the process until eventually we're able to use hydrochloric acid if needed, or not, but get to that place of being able to wean people off PPIs so they can absorb nutrients, and really enjoyed having the collaborative communication from colleagues that shared their tricks for getting there, and just realizing none of this is easy. Just strength in terms of affirmation, knowing that we're all in this journey together, but also coming towards solutions for that.